Thomas Dobbs, our State Health Officer, and Dr. Paul Byers, our State Epidemiologist. Thank you.
Good afternoon. Thanks y'all for being here. We just wanted to go ahead and brief you guys. We've had significant developments in the past 24 hours. First of all, I want to make sure we give you guys an update on the numbers. One of the things that we do is be totally transparent, and as quickly as we get confirmations, we're going to get them on the website. And today we're going to give you as much information as there is to be had. So first off, we've tested 90 patients, and now we have 6 positive cases. Okay, we have 6 cases identified in the state of Mississippi. We have details on the additional 3 cases, and we'll share those with you today. And we have additional 2 cases which we're currently investigating, and we'll update that information once it is validated. At this time, I would like to turn it over to Dr. Byers to give you details of the additional 3 cases that we are reporting information on today.
Hey, good afternoon. Thank you, Dr. Dobbs, and thank you all for being here. Obviously, it's very apparent that things are progressing and evolving very rapidly. This is not unexpected, based on our experience with what we've seen in other states and in other countries. We have really ramped up our testing capacity at the public health lab. We've streamlined those processes for providers to be able to submit samples to us at the public health lab. And with our expanded testing, certainly we have an expectation that we would continue to see more cases, and we also have expectations that we will continue to see more cases in the coming days to weeks. So as this moves forward, don't be surprised with additional cases. The 3 cases that we are reporting that we have information on today is an adult female over 65 who is a resident of Forest County who is currently hospitalized. Additionally, we have a male adult who is also a resident of Forest County who is currently not hospitalized but is isolated at home, and the proper precautions are being taken there. And then the 3rd case is an adult female from LaFleur County. This patient is also not hospitalized, but is in fact self-isolated. As you might understand, and we talked about this yesterday, that one of our goals is to do complete and thorough contact investigation to identify not only potential sources of transmission, but to identify those individuals who are the closest contacts, who are at the highest risk, and take those appropriate public health measures in efforts to prevent further transmission.
Just to let you know, we've been very active today. Certainly, we spent the better part of the day down at MEMA at the Emergency Operations Center, which is now activated at level 1, as we discussed. The governor should be in this evening, and we plan to brief him immediately when he gets back. He's been very involved. We today have had extensive outreach and had calls with about 400 healthcare providers, physicians, and facilities, explaining to the doctors how they can test and submit samples. They understand that they all have access to the testing if they want to test patients, either through our lab or through the commercial labs. Our turnaround time once it gets here is about 24 hours based on our current throughput. We do want to remind patients, please do not go to the emergency room. Call your physician, call your clinic, call your provider. Make sure that they have a chance to assess you and figure out if they need to isolate you or do any special precautions, because we want to make sure that people are taken care of, but we also protect the healthcare providers who are doing so much to make sure that we are well cared for. I want to talk a little bit about just social distancing and just reiterate a couple of things about that. Social distancing basically means just keeping space from one another, and a couple of the things that we've requested that folks do, and we've gotten a lot of calls about this also, is limiting mass gatherings to less than 250 people. Certainly if it's a smaller gathering and someone thinks it's prudent to cancel it, we are supportive of those decisions, and certainly leave that to the different individuals. And if you've probably noticed, a lot of things have been canceled if you're paying much attention. And then as regard to school closures, I know that's something that people ask about a lot. CDC has fortunately given us pretty good guidelines about best practices for school closures. We plan to review those very thoroughly whenever we're talking about a school closure. These are decisions that are made in in a partnership with local school districts and the Department of Education. Now, school districts have full authority to do what they think is proper, and we certainly we wouldn't presume to supersede their authority, but we would request that if a decision is being considered to close schools, it's a big decision. It's very disruptive, and in certain circumstances, there's no evidence that's really beneficial to the community, so we would like to be very thoughtful before we make any decisions of that nature.
Thomas, can you explain, because we talk about the 250 and people will say, well, schools have more than 250 people. We are talking about 250 people.
In a single location.
Correct.
Yeah, so we're talking about, there's more than 250 people in this building, right?
But we're not all.
Yeah. We're not all in one room. So, us in this room are in worse shape than the rest of the building because of our close quarters. So, in a classroom of 30 people, that's one thing, but that's what we're talking about, assemblies, right? We don't want people getting together unnecessarily in the gym or whatever, where they're going to be commingling and perhaps coming into contact with a large number of individuals.
And you're also going to be meeting with the superintendents on Monday, so we should have more information.
We've been in contact with the Department of Education. Department of Education is a big part of our state operations. The Emergency Operations Center at MEMA, down in Rankin County, and we are planning to talk to, hopefully, essentially every superintendent Monday afternoon.
And can you talk a little bit about we're not going to be naming hospitals?
Yeah, so when we report, we're not going to be naming hospitals. It's actually become somewhat stigmatizing. So if we name a county, it doesn't mean that the person is in a county in that hospital. So please keep that in mind to honor the privacy of the individual who might be there, because that might help identify an individual. And as we've seen some things that happen in other parts of the country, the distasteful events where people were identified, unfortunately, and also too to keep hospitals from being stigmatized. The hospitals, the healthcare personnel, professionals, doctors on the front lines are the heroes of this. We need to respect them and let them do their work.
So at this time, well, you go first, Ross, today.
5 of the 6 cases are in Forest County. Do you believe you have a cluster in Forest County?
Dr. Byers, you want to?
No, we've identified 3 cases from Forest County at this point. There's an additional case that was in LaFleur County, and then the other 2 cases, we're still in the process of investigating and identifying those cases.
Do you believe any of these folks had contact with each other?
That's a great question, and certainly, when we see cases that close in time, close in proximity, one of the things that we're obviously concerned about is the possibility that what we're now seeing is community transmission. Those pieces of investigation to link all of those cases to a common source exposure is still ongoing. But you're right, it is something that we need to be thinking about and considering now.
When you say you're investigating to, what exactly does that mean? Have they tested yet?
We've reported 6 cases now, right?
But you're,
One yesterday. We're still in the process of notifying physicians of their patients, trying to identify those individuals, make contact with them, identify all of their contacts. So the process of investigation is a very prolonged and detailed process.
I'm just trying to narrow it down. So there's 3 cases that are in Forest County, confirmed cases or presumptive cases.
Presumptive cases.
There's another one in LaFleur County.
Right.
Where are the other 2?
That's what we're not saying right now. That
That'll be on our
investigation is still
website.
ongoing.
Look, everyone, if you want to take a look at this is going to be on our website daily. I mean, we're going to update it in real time. And so what this is going to tell you is going to be the date, the county where the person lives, not necessarily where they're hospitalized, whether they are a male or female, child, adult, or over 65, and whether or not they're hospitalized or self-isolating at home. And Dr. Dutch, explain self-isolating, if you would.
Yeah, so self-isolating is basically staying at home and staying away from your family as best you can. If you're ill, the CDC does have guidelines that we will make sure are readily available on our website for people to review. If someone goes home and you suspect you have COVID, or if you know you have it, there are things you can do to protect your family. But basically, staying at home. You can't go to Walmart, can't go to the store. You need to get help to bring you food in, and we want to keep you out of the community as to keep you from spreading. And we're going to keep an eye on folks to make sure that they don't return to the community until it's safe.
Dr. Dobbs, you said that the governor will be returning from Spain tonight.
Yes, sir.
Do you know whether the governor and his family will be going into quarantine? Because they have a lot of cases in Spain.
We are meeting with him this evening, and I don't want to scoop what the governor's going to say, but he's going to make his own statement, and I'm going to meet with him, pretty much right after he gets back.
Go ahead.
I had okay, the two that you guys aren't saying where those cases happened, you know where they're at currently, correct?
We do.
Okay.
Are they hospitalized or are they isolated?
We're not
We're still
providing any of that
investigating
information
that,
now,
yeah.
but that will be updated on our website.
And then also, okay, so the 3 cases that we know, do we know any other details yet? Like as far as the woman who went to North Carolina, was she in a big group? I mean, was she with family members? Do we know where all she traveled to?
Yeah, there was.
Those cases that we know, do we know any other details about that?
Well, I think it's important to think about things in context now, right? Eventually, we're going to see cases in all parts of the United States. And to focus on more of travel as we move forward in this process as a potential exposure risk, when in fact we will begin to see more cases, and that travel exposure will be less significant moving forward. We don't have an indication that this individual was in any of the large group settings or was in contact with anybody else who was ill.
Go ahead.
Can y'all confirm one way or the other if any of the people that are currently in this group are healthcare providers?
We're still investigating so many of them. Let us get back to you on that, because I want to make sure that we're accurate. And we'll circle back and see what we can share.
Jimmy?
One problem over in, say, Italy is they've been overwhelmed in their ICU units. What kind of shape are we in the number of acute care beds that we have in the state? How many are actually available?
That's something that we've been concerned from the very beginning, and that's one of the reasons we've activated our emergency operations. Even before this, we've been doing assessments of bed capacity, ICU capacity. If we have a lot of cases, it's going to stress us. There's no doubt about it.
You know how many we have right now, the number?
Well, we do have a mechanism for tracking that, but I don't have it at the top of my head. Because it's a statewide sort of situation. We have taken steps to go ahead and ask docs, and it's good, I'm glad you kind of brought that up, because we've asked physicians to delay non-essential outpatient visits. So if someone's coming in for routine medical care, we're going to ask them to delay it so that people who are well don't come and intermingle maybe with people who are ill. So that's one of the things we're doing. We're also talking about, telling hospitals to look at maybe diminishing elective procedures for the future so that they can preserve capacity. These are ongoing conversations. But this is one of our top concerns, is making sure we have adequate capacity to take care of it.
When do you think you will have a number or an estimate of what the capacity is?
Yeah, let me get, we'll try to get that for you pretty quickly. That's its own sort of complicated calculation. Yes, sir. And it's ever changing, obviously.
A question about the proper protocol. If someone feels that they have been exposed or they're expressing symptoms,
Yeah.
they should contact their local, over the phone, their local primary care provider or their nearest clinic. Is that correct?
Yes, sir.
We're hearing reports from a lot of people that they're calling those clinics and they're referring them to the public health department,
Which
and
is
then you guys are bouncing them back to the clinics.
And that's why we spoke to 400 people today, in part. I mean, we've pounded this through social media and all kind of stuff, but sometimes a good conversation makes a big difference.
So just for the record, if someone calls their clinic and
Yeah.
they say, call the Department of Public Health, they should tell them that they have the capacity to do COVID-19 testing.
Yes, and so a clinic can test. Whether they choose to test is a choice.
Of course.
Now, there are some capacity issues. Now, it's important to know, when they send a sample, all they're doing is sending us a sample. They're not sending us a test.
Of course.
They're sending us a tube with liquid in it and a swab. Now, you have to have access to that tube, and that's something we've been actively monitoring to seeing what the capacity of that is. They can also send it to a commercial lab like LabCorp or Quest. So that's this is going to become normal. This is going to become normal clinical care. So if someone thinks they've been exposed and they're well, please do not worry, okay? Unless if we're contacting you, or if you've been contacted by someone who says you need to isolate, that's one thing. But if you're just concerned, it doesn't mean you need to call your doctor. We do not test asymptomatic people. It's harmful actually because it gives people a false sense of security and it's not useful. So that's going to be important to know. Yes, ma'am.
Well, and I know when we started all this, the basic advice was wash your hands, don't touch your face, you know, if you go to, we all know what that was. Now as things are starting to ramp up and things are getting canceled and different things like that, is there any new advice, or for those of us who don't get to stay home for 3 weeks, you know, because maybe, what do you advise for just the normal person who's got to go to work every day?
You know, pay attention, be thoughtful. I mean, it's here. And it's going to be something that we're going to have to adapt to. We want to protect our high-risk folks, right? So more than anything, make sure that we don't make unnecessary trips to the nursing home. Make sure that older folks don't travel. If you are one of those people, protect yourself and be mindful about where you're going. We're still in some, we've activated some things like social distancing strategies, but we're also talking with employers, and especially within state government, we've had extensive conversations about getting ready to implement telework. Looking at what would happen if you have reduced staff. So all of these things are active and encourage people to know their role. There's clear guidance on CDC and through our website. So everybody needs to know what you're supposed to do, but stay alert, because we're going to ramp these things up gradually as they're indicated. But there's no reason not to live your normal life other than making sure we are very protective of our vulnerable people right now and be aware when these things do change.
Go ahead.
Just a couple of different questions. How long does it take for symptoms to develop, and say in the next couple of weeks? How many more cases do you predict we'll have?
Boy, I wish that we could predict, right? I think we're just going to have to kind of wait and see how that unfolds. We're not going to be surprised if we have additional cases where in the state those may be found, and the number. We'll have to see how this plays out. But you've seen just yourself how quickly, in just a matter of a couple of days, how many new cases we've identified. From the time that an individual is exposed to somebody who's infectious, it can take up to 14 days before they begin to show symptoms. So that's the incubation period. It's probably shorter than that. It's probably 5 to 6 days, but the range is up to 14 days.
Go ahead.
Where should folks who are uninsured go to test?
That's a great question, and it's come up a lot. First of all, the Department of Health doesn't have clinical staff. We don't provide primary care, so we wouldn't have anybody there to provide a clinical assessment. And most things that people have now, even though COVID's here, most things that people have are not COVID. They need to be taken care of for whatever they do have, and we don't want to let people's care be compromised because we have sort of blinders on about everything being COVID. So if you're ill, you need a clinical assessment to make sure that the right thing's done. We have been in contact with the community health centers just today, making sure they understand what needs to happen and how they can get access to the test. If the test is done at the Department of Health, the test is free. It's free of charge to the clinic and to the patient. So it's accessing the care, which is going to be probably one of the bigger challenges. And we've talked with providers across the state saying, we encourage you to be flexible, and if there's back balances and stuff like that, this is a different scenario, and we'd encourage you to, step up to the plate and understand that this is an extraordinary circumstance, that it's a team effort, we all need to work together.
How many tests do you have?
It changes daily. We still should have about 1,000 left, more or less.
It's approximate.
It changes. We order and use, but we don't see any acute shortages at the time being, or for several days to come at least.
Ross?
Do we know what time the governor's going to make his statement?
I do not know that. I do not know.
I bet Renee would know. Maybe, I don't know.
I'll ask her.
Why don't you just hang out at the airport tonight?
Let me get some
Then I'll have to
clarification
go in self-isolation.
on the Forest County cases. It was reported earlier that the first person who tested positive was on a flight to Florida, South Florida, and that a companion was with that person. Is that one of the new persons that is tested positive?
That's not something we can say. I mean, those are intimate details that could potentially identify somebody. True or untrue, that's just beyond what we're able to answer.
Is it fair to say that a lot of these cases are related to some type of travel?
It's so hard to say, like you said. Yeah.
That's been sort of the running theme to begin with, but I think as we begin to do more additional investigations, we're gonna find that there are cases who have not traveled outside of Mississippi, and that's gonna be the norm moving forward.
Last question, there's one person over the age of 65, is that correct?
I believe that there are two that we're reporting.
Two, there's
Yeah,
two.
yeah.
The LaFleur County is over 65?
No, we were,
No, it's.
Ms. Forrest?
yes, I'm
It's
sorry,
Forrest.
it's one.
Just
Yes.
one, okay,
But remember, we're waiting on details for 2 from today.
okay.
In the first Forest County case.
Yes, ma'am.
That man did such a good job with him, you know, isolating himself. From what I heard, was he a doctor?
That is
Yeah.
definitely something we
We
wouldn't-
have to work, y'all, to protect the privacy of our patients, and we err on the side of being conservative. I think, Kobe, you had a question.
Yes, wanted to ask what's involved in the testing process? What does that look like?
Do you know that on our website, there's a video where Dr. Ware will walk you through the testing process?
Yeah, I noticed that at
yeah,
our last
yeah,
press
and
conference,
so,
it'll show you everything.
You know, but just real quickly, just from start to finish, come in, you call in first, right, make sure that the doctor knows you're coming. Go in, they will put you in a room by yourself, they'll come in wearing protective gear if you need the test. Everybody doesn't need the test, everybody does not need it. And they will take a Q-tip, stick it in your nose, rub the back of your throat, put it in a little tube of water. They will have to either send it to the private lab, or if they send it to us, they put it in a special temperature-controlled container. They take it to the county health department. The county health department ships it to the central lab, and then we run it the same day.
If a person is diagnosed as having the virus and is at home, but the rest of the family are not affected, do they have to also be isolated for the 14-day period?
And it would depend on their level of contact, and that would be part of what we would ascertain, you know, when we do our contact investigation to try to determine that. And, you know, CDC has got some pretty good guidelines for individuals who are at home and the protection of those people who are also in the home to make sure that they don't get exposed.
I know we've talked about how the standard isolation period is 2 to 3 weeks. And forgive me if this has already been said, but what's the standard lifespan of the coronavirus once you get it? Is there one?
You mean how long is someone
How long-
ill?
Yeah, how
or-
long do you?
You know, mostly if it's someone who gets over it pretty quickly, this is a question we got yesterday when we were in Hattiesburg. You know, it's going to be like the flu. It's going to be a course of days. And then we actually had an anecdotal case that we asked about, and he said, oh, he was a younger, healthier person, felt really crummy for 3 days, and then he was fine. So, but then if you get really sick, you know, people will be sick longer. Not necessarily that they're contagious the whole time, but maybe have a lung injury such that it takes them a long time to recover, or maybe they don't recover at all.
So Dr. Dobbs, you were talking with the physicians this morning about the vast majority of folks will not get sick, or if they do, it should be a mild illness. We're concerned about those that have immunosuppressed systems or are 65 and older. Did you?
Yeah. So, you know, most respiratory
people
infections
panicking.
are not going to be COVID. So if you have a cough, and especially if with all the pollen out there, if you just have congestion but no fever, you know, I wouldn't ask you not to talk to your doctor, but I certainly wouldn't assume you have COVID. But if someone has fever and respiratory symptoms still, most of those folks are not going to be COVID. It's going to be something else. But in the people who do get it, the vast majority of people are going to have an uneventful recovery and almost certainly immunity following the event.
Is there like a self-test you can kind of do at home? We've gotten some emails about that where you just
No.
breathe in.
That is, please, that's
Facebook medicine.
Facebook nonsense.
Facebook medicine.
Someone asked.
Yeah, no, I mean, you can't distinguish the symptoms from any other viral respiratory illness.
Anyone else have any questions? Kobe?
With Louisiana changing to where they're shutting all their schools down for the next month, Is Mississippi looking deeper into school closures at all?
You know, like I said, you know, we're going to work closely in concert with local school districts. They have authority to do as they think appropriate, but, you know, we're not recommending closures right now. We're following the CDC guidelines, which I think are publicly available, as far as like, if y'all want to look at that when they're recommended. But at this stage of activity within the state and within local communities, it's not recommended. But then again, we're considerate to other people's concerns and would like to be in consultation with school districts and Department of Education if those thoughts are being considered.
I just have one more, y'all. I've got a Facebook person asking me about reinfection rates. Is this something like some diseases where you get it and then you're immune to it, or does it come back?
It looks like you're immune to it. I mean, reinfections of this sort of thing do occur in people who are severely immunocompromised, right? But even then, it's pretty rare. By and large, we expect people to have immunity after it. Some of the reports earlier from China and places, one of the things you have to realize is that if you do a million tests, some of the tests are going to get kind of screwy, so that's not surprising. But if it's a DNA test, sometimes the DNA or the RNA, the genetic material that's there, will stick around longer than the infection. And so sometimes people get confused and think they're reinfected when it's just residual material from their initial infection.
Anybody else have any questions? Okay, so don't forget, check the website. We will put something out on Facebook letting you know that we've updated our number of cases.
I'm sorry, can I just get some clarification on the investigation, the cases that are under investigation? They tested positive, or how does that work?
They did test positive. They had a positive test, yes.
But you're not announcing additional details?
Because we are just digging in on the details,
Okay.
because it's a laborious process.
So it's fair to say there are 6 presumptive
Yes.
cases?
There
Yes, sir.
are,
Yes.
that
Yes,
is
sir.
Is there a
accurate.
reason that those 2 cases have not been disclosed?
It's
or
hot
that
off
others
the
have?
press.
We just got it.
It's
We
hot
just got
off
it.
the
Literally,
press.
you know?
Yeah.
We
Yeah.
literally
Literally.
found out before you guys
When
walked
do you
in
think
here.
when do you think we might know where those cases are located?
Tomorrow,
Yeah,
tonight.
we'll update the website. And I encourage y'all to check the website, because as we get more cases, those are gonna be posted there with those updates.
Thanks, everyone. We appreciate you.
I appreciate y'all getting the message
Thanks, y'all.
out. It's very important.
Thank you.
Thank you.